The term head lice certainly has a stigma. Unlike measles, mumps, and chickenpox, this condition brings up images of poverty or even poor hygiene. But nothing could be further from the truth.
I think sometimes people, when they have head lice, there's a sense of shame, like, oh my goodness, why does my child have head lice? And that's simply, it's not because your child is dirty, it's not because a family has lower socioeconomic situation. It happens across the spectrum, and it happens in kids with very good hygiene, and it also happens, of course, in kids with very poor hygiene.
With some studies showing the problem affecting 1 in 4 children, it's obvious a head louse loves anyone. While it's not dangerous and doesn't spread disease, it is highly contagious and irritating, so parents should learn to spot it and treat it right away.
What they're looking for is itching or an active louse in the hair. So a parent may look into the scalp and they'll actually see a tiny little creature crawling at the base of the scalp, or the base of the hair shaft in the scalp. And they also may notice a small knit, which is what turns into a louse, and that knit will be adhered very strongly to the hair shaft.
Dr. Owen recommends an over-the-counter shampoo or lotion to treat head lice. Your pharmacist or doctor can recommend one. And make sure you follow the directions. It is an insecticide after all. And it's important to keep in mind, however, anti-louse treatments have not been tested for children 2 years of age and younger. So it's important to be nitpicky, especially in the case of a toddler with head lice. Use a nit comb every 2 to 3 days to remove nits and lice, and continue to check for 2 to 3 weeks until you are sure all lice and nits are gone. And parents, lice hate dogs and cats, so no blaming the family pet. This is a people problem. And because head lice cannot jump or fly, direct contact is the only way you get them. Taking steps to avoid them will be a big help.
Ways to prevent it at school are not sharing towels, not sharing any of your toiletries, your combs, if a sibling has it, not sleeping in the same bed, not sharing the same sleeping bag, or at camp, or any other type of bedding. So basically not coming into contact with it.
If your child does come down with a case of head lice, applying a treatment, some picking, and a lot of patience should be enough to send those pests packing. For Smart Medicine, I'm Lorene Cachola.